Hi, it's Dr. Jamie here, talking to you today about anxiety. What is it? Why do we have it? And what can I do about it? We know that anxiety is, of course, a feeling that's universal, and no one's immune to it, and something that we all will experience many times throughout the course of our life. And it's felt in the body. So there's a whole host of physical symptoms that go along with the experience of anxiety, things like tightness in the chest and other muscles, having a racing heart, nausea, tingling, cold sweats, and like I said, many other symptoms that can go with being anxious. Anxiety is not our thoughts. So I had a client that said to me once he was anxious because he thought he was going to die alone. That wasn't his anxiety, it wasn't the experience of anxiety. It very well may have contributed to the experience of his anxiety, but it wasn't the anxiety. And it's also not our behaviour, it's not what we do. So I had a client that said to me that he left his own birthday party because he felt quite panicky. That's how he responded to his anxiety, but once again, it wasn't that physical experience of anxiety in the body. So why do we have it in the first place? I mean, it feels unpleasant. Why do we need it? Really, fundamentally, it's designed to keep us safe, to keep us out of harm's way. It's our body's way of alerting us to any kind of threat or danger in the environment, and all those symptoms that you experience in your body. It's just your body's way of gearing up to either defend through fighting off or running away from any kind of threat to your life or safety. And to that end, it's not something really that we would want to get rid of, or nor something that we could get rid of. And so I think at this point, probably a really important distinction to make is that between anxiety that's universal and felt by everyone versus what we might call an anxiety disorder or clinical levels of anxiety. And that's where anxiety really starts to interfere quite significantly in someone's functioning, be it their day-to-day life, their work, their relationship with other people, or just their sense of well-being within themselves. We know that about 1 in 3 people will experience what we might call an anxiety disorder at some point throughout their life. Really one way to look at this is when that internal alarm system in your body becomes a little bit oversensitive, in much just the same way as the smoke alarm might go off if you've burnt the toast. You can't really tell the difference between sort of a burnt toast and a house that's burning to the ground. Sometimes our body's internal alarm system becomes overly sensitive, and it will send messages to our brain that we're in danger when really there isn't a significant threat to life or safety. And so thinking about how to manage anxiety, we know that there are a whole range of self-management strategies that are really effective for more milder forms of anxiety. So things like getting adequate rest, having proper nutrition, physical exercise, relaxation, mindfulness strategies, managing your diary, so saying no to kind of overcommitting yourself, setting boundaries. All of these things are really fantastic ways to keep anxiety levels in check. But certainly if it reaches a point where you've done all of the self-management strategies and that hasn't really helped in any significant way, then it really suggests that you might need to go and have a chat to your GP around putting in some other sort of form of plan to address anxiety. We know, of course, that particularly for anxiety disorders, but certainly for most psychological difficulties as well, the talking therapies, the psychological therapies really are best practice and first-line treatment as opposed to medications, which in a lot of cases should only be offered, sort of where therapy has been trialled and it hasn't sort of worked out. But have a chat to your GP about that. They can help you along the way with what course to sort of take and how best to approach anxiety. So a big topic, and probably one that I might do a few other videos on in the days ahead. So keep a lookout for that. I hope it's been helpful for people out there. Let me know if you have questions or comments and feedback, and I look forward to talking to you all again very soon.